Well, good morning, everyone. Happy Friday. I'm Senior Reporter for 7 News, Eileen Buckley, and joining me in studio is Jean Kihl, and she is the Senior Medicare Sales Representative for Independent Health. And Jean, we are here to help everyone today, and we want everyone to try to participate in learning about Medicare enrollment. It is a difficult thing for some people to navigate,
Yes,
and it's important to note that you have from now until December 7th to select.
Yes.
And that is for your medical and your prescription plan options. Now, remember, this is for those 65 years and plus, but there's also those under the age of 65 with disabilities that also may enroll.
Yes, that's correct. Once someone's on disability for 2 years, they automatically become eligible for Medicare.
So important for everyone to note. Now, if this isn't for you right now, this is not something you're eligible for, we want to let you know that we're going to give you information. You might want to take some notes for your parents, your grandparents, relatives, aunts and uncles, maybe even your next door neighbor. We are a voice for our community, so we want to help people. And this is what I've heard is a very tricky thing to navigate.
Yes.
You told me a great story before we started here this morning. From a doctor's even perspective
Yes.
of how difficult and daunting this can be for some folks.
Absolutely.
Tell a little
I
bit
have met with doctors, I've met with lawyers, I've met with teachers, and they can do open heart surgery, they can teach kindergartners, and they can win a big case. But understanding Medicare is difficult. And they're like, Jean, I need your help.
Absolutely.
So,
So
yes.
hopefully you can be our expert and bring us through all of this today. When you're eligible, tell us, it pays for what when you're eligible for this?
So original Medicare comes with two parts. Part A, which is the hospital of original Medicare, and Part B as in boy, which is the medical portion of original Medicare. So with those, you do have hospital and medical coverage, but Medicare does not do prescription Part D. So with hospital and medical, there are deductibles to meet with original Medicare first, and then after you meet those deductibles, Medicare pays 80% of the cost, and the member is responsible for 20%.
This might be maybe a dumb question on this part, but do you have to re-enroll each season?
You don't have to re-enroll if you're happy with your plan, but what you do have to do is take a look at it because plans could change every year. So you always want to make sure that the plan that you're in is working for your needs, and certainly to make sure it's acceptable. If something goes up really high, you might want to, look at something different. But we sit down with everybody and help them to navigate through all of this.
So let us know if you have any questions. We really are here to help you out. Jean is, fully capable of answering probably all of your questions today. They gave us quite a bit of a rundown of what they can talk about today. Talk about these Medicare Advantage plans, because when you sign up, you're signing up for Medicare Part D, which I've heard some folks for their prescription plan is difficult in selecting that. And I don't know in a nutshell if you can explain how it works, but that might be helpful to kick us off too.
So a Medicare Advantage plan is where you get all of your benefits through one company. So like Independent Health, we have plans that run from $0 on up. We have 3 $0 plans actually. But what we do is we include the hospital benefit, the medical benefit, and Part D prescription benefit. And then we also put wellness in our package. So, people get dental. We have beautiful dental benefits. They get vision. They get fitness club membership at no cost, hearing aid benefits, telemedicine, teledoc, over the counter. So in our plans, all of that is for our members so that they can live healthy lives. They can rely on a good company that's going to be there for them, especially when they really, really need services. And again, we sit down with everybody and go through everything with them to make sure they are always in the right plan for their needs.
And I'm just going to take a moment here to talk about the Medicare information centers that Independent Health is hosting. You have them kind of around the community, which is terrific. We have it up on the screen for you. Again, please send us your questions right now. Jean's ready to tackle those for you. Jean, I want to ask you, because I've heard this so often, and I know even, I believe my mother-in-law has this as well. you have these supplemental health insurance plans along with it.
Yes.
Why are those so important for folks?
So supplement or Medigap, they call them, work a little bit differently than a Medicare Advantage plan. Those plans are generally for folks that are using a lot of services. So first you show your Medicare card, then you show your supplement card, and then you go buy Part D. So that way you work with 3 entities. However, usually the supplement that you buy will pick up pretty much everything that Medicare does not cover. And again, those are for people who really use a lot of services.
And that's so important too.
Yes.
The other thing that seems complicated is when you hear about Medicare Parts A and Parts B.
Yes.
What is that?
So Part A is hospital benefit. Part B is the medical benefits, such as your doctor's visits, your lab work, your x-rays, those types of things. You do have to have Medicare Part A and B in order to have a Medicare Advantage plan or even a Medigap or supplement plan.
You also have, we had up on the screen just a short time ago too, you had some temporary sites opened as well.
Yes.
So tell us how that works when members, do you have to be a member of Independent Health to get help on this?
Absolutely not. No, anybody that comes through our door, we are more than happy to help them.
We just got some comments in here. So Karen is asking, is there dental coverage? And I think you mentioned a little bit of that just a minute ago.
Yes, absolutely. In Independent Health's dental or Medicare Advantage plans, you get up to $2,000 for dental on our HMO plans and $1,000 for our PPO plans.
That's really important
Yeah,
too.
so that helps not only with their preventative, but also if they need a filling or a tooth pulled or something like that. So that's embedded right in all of our Medicare Advantage plans.
So important. Karen, thank you for that question because our dental is so important to our overall health
Absolutely.
too. So
Yes, it
if
is.
you can have help paying for it, that's key.
Yes.
What about Brian is asking, over the counter, are they covered like Tylenol or bandages?
Yes, absolutely. And much more. It really surprises me the things that we cover for our over-the-counter benefit. Vitamins, allergy meds, cough medicines, grab bars for people who might need those, compression socks for people that need compression socks, all different kinds of things that they can choose from. And they go online if they could. They order by phone or by mail. Once their order is placed, it comes right to them within a couple of days.
You know, you don't think about that if you're having knee surgery or any type of surgery where you come home and you need, you know, help in the shower with a shower seat or anything like that.
Exactly.
And those are really difficult expenses sometimes, and you're only
Yes.
using it perhaps for a short time,
That's right.
maybe handing it down to somebody, but at least you can have some help in paying for that.
Yes, absolutely.
So important. Thank you, Brian, for that question, because I don't think we think about those outer needs of our healthcare.
You're absolutely right. Yes.
Jean,
But
can
it
you
is important.
tell us what are some of the challenges people face when they come to you? Tell us what some of the comments and questions are when you're navigating this every day with folks.
Yes, absolutely. So we have lots of questions, and of course, it always depends on what the person's need is. But the questions are, what is Medicare? How do I get my Medicare? What does this mean for me? What kind of costs am I going to pay? You know, and so prescription Part D coverage sometimes could be the little of the way it works, a little tough for some. But again, there's a lot of help, and we do everything we can to make sure every single person is understanding and gets the help that they need. There's programs out there that we can refer to help with some of this information with high costing medications or certain illnesses that people need special circumstances for.
Just to let you know, we are still waiting for more of your comments to come in. We're happy to help you here. Remember, we're a voice for the community here at Channel 7. We want to help you navigate this Medicare open enrollment season. And Jean here, of course, is an expert with Independent Health. We're so happy to partner with you today. I know you go by the motto of the red shirts helping you. So
Yes.
we wore red today to
Thank
help
you.
folks with that.
Yes. Years ago, we were like, how are people going to know who to come to after a big seminar of like 400 people and then sitting there waiting for help. So they came up with the red shirt. So we would do a presentation, and after the presentation, we would say, anybody who has questions, go to a red shirt. And that's how it really began,
Oh, that's terrific.
So, and we've just carried it on through. But red shirt means more than just wearing a red shirt. We definitely go well above and beyond to help everybody in every way that we possibly can. We actually are like family. So anybody that walks through our door, they're just not another person walking through our door. We're going to be there for them. We're going to not just be there for them to help them the first time, but we're there for them right on through, So it really works out great and wonderful relationships. I get to met the greatest of people.
And I can imagine you're helping folks navigate through their health care.
Yes.
And for some folks, it can be very difficult if they're dealing with, disease and chronic illness. Unfortunately, there's so many things that we each have to navigate in our lives every day. So having you folks there to make it a little more simplified.
I have cried with them. I've laughed with them. We've hugged. So, yeah, it really becomes, I look at every person that I'm with as what would I do for my family to make sure that that person is getting everything that they need. Because there's a lot of heartache out there. There's a lot that goes on. But again, I know that we're going to do everything we can for them.
Just having that person to listen and help navigate through the complicated paperwork.
Yes.
What's the choice with these Medicare Advantage plans?
As far as what types of plans?
Yeah, yes. And understanding what that is different from.
So a Medicare Advantage plan comes with either HMO, which stands for Health Maintenance Organization. Those types of plans, you use the network that the company that you are looking in has their provider network. Independent Health is affiliated with 98% of the doctors in our area, all the hospitals, just about all the pharmacies, so we're easy to use. They also come with what's called a PPO plan, and that stands for Preferred Provider Organization. And those types of plans allow people to go out to other states and seek a doctor. So we have a beautiful PPO plan that we just are coming out with for 2024. It's $10, and we are a part of what's called a multi-plan network. So there are over 80,000 providers throughout the United States that members can see. Even though they're out of network, they will pay in-network costs if they're a part of the multi-plan network. So it really opens up the door for a lot of folks to kind of be able to do what they want too. Sometimes they are in Florida for a few months. They want to establish a doctor there. Those types of plans allow them to do so.
Talk about hospitalization. What happens for folks when they're on Medicare?
Okay, so in our plans, we have a cap on hospital. So they pay a one-time, like a 6-day, and each plan is different, but that's it for the year then. And it's not a very high cost at all, okay? So for us, it doesn't matter how many times, for benefit purposes, I always say that someone's in and out. They only pay a small amount of money for the entire year. So again, that helps that person who has frequent hospital stays not to always be pulling money out of their pocket.
Sure, because I think that's kind of almost a frightening thing for your finances. You hear a lot of horror stories of people being in the hospital for any length of time and then having mounting medical bills. Right. Have you had situations with folks where you've had to help them out of those situations when they've enrolled?
I'll be honest with you, not really, only because, again, we sit down with everybody and we go through everything so they know what to expect. Or they'll call and say, okay, I have this going on. What do I need to do? Or what is this going to cost me? The nice thing about a Medicare Advantage plan is there's an out-of-pocket maximum. So they are protected no matter what could possibly happen medical-wise with a certain amount. If they hit that amount, they have no more medical copays than for the rest of that year. So it's a little bit of peace of mind to know that I'm not going to lose everything.
Absolutely. I want to ask you, and we have a great question here too from Kathy, because this was my next question on the list. So Kathy, you beat me to it. What does being a 5-star plan mean?
Oh.
I know that sounds like this 5-star rating. Well, is that just about your organization? But there's so much more to that.
There is so much more to that. So there are, I believe, 40 different components that go into a star rating. I might be off a little bit, but I think that's what I know is it's 40. And there are so many things that go into a star rating. How we manage our medical on the back end for our patients or members that are not doing well or they're ill. Um, Everything we do, authorizations, and even how fast do we answer the phone when somebody calls? How do we resolve their issues if they have issues? So much. I can't even begin to tell you how many things go into a 5-star rating by Medicare. 3 years in a row, independent health has been rated 5 out of 5 stars. That's almost unheard of. I am so proud. I can't even begin to tell you how proud I am to be a part of our team and have this great 5-star rating. And that allows us to help people out throughout the year. So we can bring anybody on to independent health anytime throughout the year just using our 5 stars.
So the hard work that you put into it's going to benefit you out there as the consumer.
That's
really
right.
works very well with that.
Yes, that's right. That's right.
Kathy, thank you so much for asking that because that was part of our questions for Jean.
Yes.
Again, Jean and I are here to help with your questions that you have on Medicare enrollment. We don't want you to run out of time for this because it only goes through December 7th, I said.
Yes, that is correct.
And I have another response here from Brian. He said, I'm looking at the fitness silver sneakers. How do we join a gym and how do they join or pay it?
Okay, so first of all, there is no cost. Okay, they get the silver sneakers benefit comes to our members at no cost. And there's a couple different ways that you can enroll. You can go online and enroll in silver sneakers through their website, or you can go right to the gym that you would like to join and they will help them also get enrolled in the silver sneakers program. And the good news is they can use more than one gym. And it's nationwide also.
That's fantastic. And it's probably so recognized when they walk in.
Yes.
To be a part of that.
Absolutely. Our members love that. They love it. They make great friends. They get out of the house. They, are doing things to stay healthy. So it's a win-win all the way around, because you're out there and you're not only having fun, but you're doing great things for your health.
Silver sneakers, if you look on our screen right now, we're showing you a little bit about that and how it works. And it's just a great way for the seniors out there to stay fit. Whether you're in your retirement or still working and you're on Medicare, this is so important because, again, your overall health is going to matter when you need all of these unfortunate services sometimes,
yes.
Right?
And the nice thing, too, is Silver Sneakers actually has an online class, too. So for people that might not be able to get out and still want to, do a little bit of exercising, they can also do it right online.
The comfort of your own home, Brian.
Yes.
We hope that answered your question, and we really appreciate you piping in with a couple of questions for us today. If anyone else has any comments or concerns or needs with this topic, we're here for you. We want to be the voice for you to help you out and navigate this. It's Medicare enrollment time and a very important time for many folks who are on this and might not have someone else to help them navigate it.
Yes.
I was going to ask you, how much from the different population is it done online? What if, you're 65 plus and you're not into computers and you don't know how to navigate online?
Then there's other ways, but we also have at our flagship store on Dick Road, we have a health hub. And in our health hub, we do teach people how to use an iPad, how to use their phone, how to log into they can create a My IH account. And even if they may not have a laptop or some sort of a computer at home, they can come right into our office and they can look up all the stuff that they need to right through our health hub.
That's fantastic.
Yes.
I know we talked a little bit in the very beginning, excuse me, about those that are covered with disabilities. Tell us some stories of how you've helped folks, because that's just, a difficult thing in their lives to navigate.
Sure is.
And then to go into being on Medicare.
Right. So again, once somebody has been on disability for 2 years, they automatically become eligible for Medicare. And, they come to us, obviously, because they need some help and they need insurance now. It's all different because they might have been on a commercial plan and, maybe no longer they're not able to work. So when you become eligible for Medicare and they come in again, we go through the benefits, the eligibility. We look up their medications. We look up their doctors. We help to find avenues for them to get help in certain aspects. So again, we take those folks and we take it up a notch or 2 or 3, whatever is needed to make sure that they are getting everything that they need for their situation.
I don't know if you can answer this, but who from that population gets lost in the system sometimes that you've maybe bailed out? Or
it really could be anybody that could get lost, but if they come to us, they're not going to get lost because we're going to make sure of that. Just to give you an example, I talked to one of our members who I found out was homeless. Well, that was unacceptable. So through our company, certain departments got together and we are now helping this person. So this is what we do at Independent Health. Like I said, it's not just an insurance plan. It's much more than that.
that's
Much more.
Great testimonial to what you're doing every day and accomplishing for people in their lives. Another question, Kathy said, where should I go to meet with a red shirt with her mom?
Okay,
That's such a great question, too, because we've talked about these sites.
So we do have many sites throughout the community. You can go to any one of them that's, close to you. You will absolutely sit down with the red shirt and you will be able to be with your mom. So I always say 2 heads are better than 1, right? And we will definitely be there to help. So we have sites that are in Tonawanda. Are they up on the screen? Okay,
now,
so any one of those sites, we are there for you Monday through Friday in our sites from 9 a.m. to 4 p.m. And then we are on the phones also 7 days a week from 8 a.m. to 8 p.m.
And it's great because they're throughout Western New York and just citing, like you're in Jamestown, so you're in rural communities as well.
Yes.
They just showed Dunkirk. There's the number for you on the screen, 716-635-4900, 8 a.m. to 8 p.m., 7 days a week.
Yes.
That's why you're that 5-star rating, right? You're there for folks all the time.
Got it.
When you find someone coming in with their parents or perhaps even a grandparent, is there a difficulty with understanding from the generations of what they need to do and that help? Is this when you go to a doctor, you need your advocate there at times to help you navigate your health?
Yeah. So yes, it could be a little bit difficult because obviously these people that are coming in with their parents aren't ready yet for Medicare and they might not know anything about Medicare. So not only are we helping their parent, but we're also helping them so that they understand what they need to do to make sure that their parents are getting what they need and be able to navigate through the system. And we're a phone call away, a stop in away. We even house member services in our Medicare information centers. So people can walk in with their questions and sit down with somebody face to face instead of having to do it on the phone. So yeah, we not only educate the Medicare person, but we also help the child or whoever to help them also so that they can understand.
Yeah, because that's such a difficult thing to have to maybe take over and, keep an eye on what's happening for their elderly parent or grandparents or any relative that, you might be in charge of.
That's right. And everybody gets my card when I see them with my email, my phone number. We all do the same. So it's no questions with Independent Health should ever go unanswered because we are always right here for you.
On the human side of it, any great stories that you've watched emerge when they've come in for help?
Oh, I have seen so many. Yes, it's just wonderful. You know, when you're through helping somebody and explaining to them and they stand up and they have tears in their eyes and they're hugging you, there is no greater feeling than that. It really, you become very close. And knowing that we can help in what we do, it just gives me the greatest feeling of all to know that we make such an impact on so many lives.
It's so great to see your passion about your work.
Yes, I am. I
Mhm.
just absolutely love what I do because I get to meet the greatest people. I get to help them, you know, and of course, working for independent health, I always say, I'll never wear any other color but red. I firmly believe because of our passion, compassion, trust, caring, all of that.
We have another comment here from Amy. She's asking, what is your biggest piece of advice for the children who are helping their older parents navigate Medicare, as on the topic that we're talking about right now?
So the biggest piece of advice is be involved. Ask those questions. Don't be afraid. Medicare is complicated, but we're always there to help you. You want to make sure that you understand so you can help your parents or grandparents or relative so that they know what they're doing too. And again, we're here. Questions, anything you need, phone call, email, or a stop in away.
And right now, we're here for you as well. We're here to tell you about how you can enroll in Medicare right now as the enrollment period continues. We are here with an expert, Jean Kihl. She is with Independent Health, giving us so much great information. Kathy says it's been so helpful, Jean, so that's important to know that you're giving out great information. She said, what should she bring along when she brings her mother to a Medicare site?
That is a great
It
question.
really is.
So what we always want someone to bring along is a list of medications, if they take any, a list of their doctors, any concerns, specific concerns that they may have. And if they have their Medicare card already and they're enrolled in A and B, they can bring their card along with them because we can look up certain things for them if need be by using their Medicare number. So definitely prescriptions and doctors are the most important, and then we do everything from there.
Oh, excellent. Excellent information, Kathy. Amy, thank you so much for those questions. We're really here to help you navigate this. We're about almost a half hour into this, and I think at this point I'm not seeing much more comments, so we're probably going to wrap it up. Amy, Jean, I just want to thank you so much, and again, give out the information we have on the sites that people can come to
Yes.
directly for help, as we talked about with anyone that you're helping out. If you are a caregiver, you can go to those sites, and you can also call 716-635-4900. Again, 8 a.m. to 8 p.m., 7 days a week. That really works around so many people's schedules.
Yes.
That they should be able to come in and get the help that they need and the help that they deserve and the great help that you provide.
Thank you. And we are the local company left here in this area. So everybody that works at Independent Health lives in this area. The monies from Independent Health stay right in our community. We are so involved with helping in the Buffalo area, in all areas. But, you know, like I said, when you come in, you're going to see somebody that walks the same streets as everybody else in this area does. So
Western
I
New
think
Yorker,
that's
right?
so important. Absolutely.
It
Yes.
really is. We want to thank everyone for their great comments this morning. We hope we helped you. We hope we served as a voice for you in our community on this topic. It's not an easy topic. There's so many moving parts. There's so much more information out there. But again, Jean is here to help you from Independent Health. Jean Kihl, we want to thank you so much and Independent Health for teaming with us here at 7 News to talk about this topic. We hope we helped all of you today, and have a great Friday. Thank you so much, and thank you, Jean.
Thank you.